And then in the third trimester, the way I train is we just do a lot of strength training. I'm not bothered about your heart rate increasing. You're going to walk up the stairs or bend over to pick up your shoes. Your heart rate's going to go up, right?
Yeah.
I know that already. What we're thinking about now is like that mind-muscle connection and maintaining those movement patterns. That's it. And doing a lot of unilateral work because the pelvis is such a mobile structure. And we know that actually the more we move and manipulate the pelvis, the more likely the baby is to get into a better position.
Hello and welcome. Today I'm here with Nikki. And Nikki is midwife and becoming basically a celebrity and influencer in this field, which is very cool to me because you really started with pretty much a normal classic Instagram account, right?
Yeah.
And you just like build it up on talking about pregnancy, training, fitness in pregnancy and all that.
Everything.
Yes, everything.
Everything pregnancy, post-pregnancy related.
Okay, cool. And that's what we're going to talk about today, specifically regarding the fitness.
Yeah.
So I always start with this. Tell me your sport history, sport background, how you got into fitness, what you, since you were a child, like what did you play? What did you do as a kid?
So I was quite an active child. I played netball. That was my main sport when I was younger. Up until I was about 17. Played for the county. I actually really enjoyed it. And then kind of drifted into that partying mode.
Okay. Netball.
Yeah.
Is it a big thing in UK?
Big
You
thing.
from UK?
Yeah,
right?
big thing in UK.
Yeah?
Oh, yeah.
Okay, so I don't even know what it is. So can you...
It's, how do I explain netball?
Oh, there you go.
Yeah. Netball. It's kind of like, it's very similar to basketball, I guess, but you're not allowed to move with the ball. When you land, you have 3 seconds to pass the ball. You are on a court and certain people can only go in certain parts of the court.
Okay.
Apart from the centers who can go everywhere. So there's 7 people on a team. And it is exceptionally savage.
Yeah?
Oh, yeah.
It's like a rugby and basketball together?
When girls play it is, yeah.
So girls are more violent than guys, yeah? Yeah.
Oh, yeah.
Usually they are.
People get elbows, teeth knocked out, the lot.
You have all your teeth?
I have all my teeth. I'm the one that's doing the elbowing.
Okay, yeah. You're pretty tall, so you could reach better.
So yeah, it's huge in the UK. It's actually pretty huge here. There's a lot of people playing netball here. They have a big netball league.
Well, yeah, I mean, this is always like, if you ask me, then CrossFit is big here or Brazilian Jiu-Jitsu is big here because that's the circles I'm in, right?
Yeah.
Netball, never heard of it.
I mean, I'm not in the netball circuit anymore.
Okay. So you stopped at 17 because alcohol and music was better, yeah?
It's more fun, you know?
Yeah.
And then I kind of just dipped in and out until I was about 23. So a nice 6-year partying stint.
And that was during your university?
Yes, yeah.
Yeah.
And then I started CrossFit. I started weight training and then I started CrossFit. And my party lifestyle kind of just dried up for the majority. Okay. Because I had to choose I really like this and I can't do both. They can't exist together. Which one do I choose?
Yeah, doing hangover workouts
Not the
sucks.
one.
So.
Yep, I just can't. I just can't do it. And then for a good few years, I did CrossFit till I was about 33. So
how old are you?
37.
Really?
I had to think about that.
Oh.
It's I don't know. How old am I?
That at least makes me to feel less bad that I didn't know how old are you.
Yeah, good.
But when you said till I was 33, I was like, what? I didn't know.
Because I look 33 now.
Yeah, for sure. Yeah, not even.
So yeah, I did CrossFit for quite a long time.
And what kind of changed? You said you started weight training and then went into the CrossFit. How hardcore core partying university college girl just finds weight training and goes into the sport?
Do you know what? My first degree wasn't my midwifery degree. My first degree was just a random geology kind of...
Geology?
Yeah, like...
My first attempt was history, so...
So I kind of just went to uni because I thought that's what people did. And I think 17, 18 is too young to decide what you're going to do with the rest of your life.
100%.
So I kind of went to uni, and then when I realized I actually think I want to do midwifery, I then reapplied. So when I was 25, I trained to be a midwife.
Okay, so you already finished.
Yeah, so I'd done like a whole load of stuff.
So you did geology?
Yeah.
Geology?
Yeah.
What was that about?
I was good at like that sort of area of my A levels. I did geography and I got like an A in it, and I quite enjoyed it.
Okay, what would that qualify you to work, like Google Maps or?
Do you know what? One of my old uni mates from that course now works for like BP or something, and she's probably makes more money in a month than I'll ever make in my entire life. So, you know, for some people it works out well.
What do you say, BP?
BP, British Petroleum.
Okay. Petroleum. Okay, not Parliament.
No, oh God, no. No, that's a waste of time.
Okay. All right. Well, cool. So basically she's digging out the oil reserves somewhere.
Yes, she's ruining the planet, but you know, she's getting paid well for it.
Yeah. So some bad stuff is worth it, right?
Apparently so.
for some people.
Yeah.
Okay, it was a nice kick to your old mate from the high school.
She'll probably never hear this, but whatever.
Yeah, but we can send direct link.
Directly to her, yeah. I'll tag her, right?
Like, tag her. We talked about you.
Yeah, you and all your money.
Okay, and so you're studying this.
Yeah, so that was more of my midwifery degree was very different to obviously my first one, because it's almost like a full-time job. You are working you're in hospitals, you're on the job learning, and you're doing 12-hour shifts, the same as everybody else. You're just not getting paid for it, and you're learning on the go.
How long for?
3 years.
3 years.
Yeah.
And then you have like a degree or certification?
Yes, you have a degree.
Like a Bachelor of Science. Okay, Bachelor of Science in midwifery.
Yes.
Let's get back to fitness and then we'll go back to this.
Basically, I was just drinking and going out and partying less anyway, because the responsibility of that degree and that job. And
also that came first.
Yeah. So I naturally kind of was just like, well, I need to fill my time doing something, and it's stressful. So I got a PT at a local gym, and I really enjoyed that. And then one of the guys I was dating at the time, he was just like, oh, you should come to CrossFit with me. You should come to CrossFit with me. It's so good. It's so good. And I was always like, no, leave me alone. Like, the more he would say it, the more I'd be like, no, I'm not doing it, just because, you know, sometimes I'm a bit like that. And then actually we stopped seeing each other, and I was like, right, now I'm going to go. So I went.
Revenge.
I went and I went to one class, and I was like, yeah, okay, I really like this.
Okay. Nice. And, okay, so there was like a transition there.
Yeah.
Now, when you started to, like, was your choice of a healthier lifestyle, let's say, also partly because you've seen what is happening in the hospitals, and maybe like that fit moms are better than non-fit moms, and you know what I mean? Like actually seeing impact of possible impact of bad choices versus right choices.
Because I was also working in orthopedics at the time, and I was working in the emergency department to get money as a student. I was doing like extra shifts. So the things I'd see, like, like 40-year-old men, women just drinking too much, or just being so unhealthy that they have like ridiculously bad heart problems, liver problems. And I'm like, you're 40, 45. Like, this is not normal.
Yeah.
And yeah, things like that. Diabetes, very prevalent. And that's very prevalent in pregnant women anyway.
Yeah, the
gestational one. Yeah. So a lot of that stuff did. And you know what? Being a midwife's physically hard.
Really?
Yeah, it's like you're on your feet all day. Okay. You're delivering babies, like they're standing up, so you're squatting on the floor trying to catch a baby in a pillow, you know? And just being generally like, I don't know how people do it that have health issues or, you know, back pain, joint pain. Loads of midwives complain about having back pain, joint pain. They don't eat properly, so they gain weight. They don't exercise, so they don't lose it. I didn't want to spend my career just getting in worse and worse shape for the sake of my job.
Yeah. So basically the Instagram handle you have, the Fit Midwife, that means like, I'm fit.
At points in time, I am fit. It's not a consistent fit. That changes.
Yeah, but well, define fit, right?
Yeah,
it's a journey. So
yeah. Oh yeah, really is.
Yeah. When partying and all that, okay, you're like 23, okay. Did you see negative impact other than hangover and headaches on your body? And
yeah, I just didn't like how my body looked.
Oh yeah, so like it got to a point that you were not happy with yourself as well, yeah.
Yeah, okay. and I was smoking as well.
Oh wow, okay.
Yeah,
so
I went
full
all in. I'm all in or all out generally as a person.
Okay, well that's good if you choose the right direction, right?
So yeah, I just didn't like how my body felt or how it looked. And I was actually like probably skinnier then, but like it's what I call skinny fat.
Okay,
you know what I mean?
Yeah.
Absolutely no muscle tone. But I'm slim.
There are 4 categories, right? And like immediately if I will say it, you can project in your head like, okay, this is that person, this is that person. You have non-fat and fit.
Yeah.
Then you have fit and fat. That's many like the strongman guys, like they have excessive fat, but they are also fairly fit, you know? But then you have also unfit and fat. Oh, that's the worst kind, yeah? But you have also unfit, unfat. And that's what you're saying, yeah? Like skinny, but weak, not really useful.
No, it wasn't.
Like,
only useful for metabolizing alcohol, really.
Well, that's what you needed at the time.
I know, it's exactly what I needed.
But that's the vicious circle, right? Because then...
So that's what kind of made me change.
Well, that's actually pretty cool because because of character of my studies, I kind of had to be like really on point straight away because I had 6 hours sometimes of a physical training through the day. So going with a headache there, that wasn't a great idea. I think I was in 5 like real hardcore parties, and not drinking, but like staying up late and stuff in 5 years of studying.
Wow.
Okay, so so that was me. However, I've seen it on my classmates, I've seen it on other people, and actually deciding that, okay, no, this is it. And if you're still in that environment, that's pretty mature decision, right?
Yeah.
Yeah.
Yeah. It was just what I needed at the time.
Yeah. Cool. Well, it came.
Yeah. Kidding.
Earlier or later.
Eventually I got there.
Eventually you got there. And you start to train.
Yes.
You start to enjoy CrossFit.
Yeah.
Because your ex wasn't there anymore.
I mean, he went to a different one. I made sure we weren't going to bump into each other.
You mean different
CrossFit gym.
CrossFit gym, okay.
Not going in the same box as the ex.
Okay.
No.
Okay, just to show off. Like, now I started.
Now I'm like, so I did. I loved it. I really got into it. And
this was still in UK, right?
Yeah.
Okay.
I think CrossFit has that addictive element to it. And when people join for the first 3 to 6 months, they're like, Jesus, this is hard. I'm not sure. And then they get past that threshold and they're like, oh, CrossFit all the time. And then you just go to the other end of the spectrum. So I did that. And then eventually scaled back to the normal point of it.
Yeah, but that's a pretty
it's a normal
standard
progression, isn't it? Yeah.
We see it all the time.
Yeah.
And some people have that initial period that you described way shorter because of, for example, their athletic background or they just pretty good. What is really exciting about that first 1.5 to up to 3 years of CrossFit is that you constantly learn something new and there is always something to improve. And once it gets to a point like, okay, so you get some handstands, you get maybe first muscle ups and stuff, and now it's more about, okay, how do I get faster? How do I get,
Yeah.
And that's when people start to go too far,
Yes.
but they are not enjoying it as much as at the beginning because they are necessarily not learning anything new. They're just going harder and harder and harder.
Yeah. They're just killing themselves a little
Yeah.
bit to, yeah.
Every day, a little bit.
Yeah, every day, yeah.
All right. So, what was your decision to go into the midwifery? Like, how do you even come to that kind of idea? Where you found out about it? Because it's not like a little girl's dream that
No.
this is what I want to do.
Well,
right?
you say that. Do you know, it's a really, people
Or
ask me this
standard.
question all the time, right? And I don't know, like my answer is I don't know what made me want to do it, but it's something that I think I was always a bit fascinated with even when I was younger, because my mum has this little book, you know, when you're in like primary school, 4 years old, 5 years old, and you cut things out of magazines, you stick it on paper, you make a book. And mine's about how I want to work where all the babies are born. So from like 4 years old,
Oh, so you knew.
apparently I
Okay.
knew. I mean, I went the long way about it, but I knew. And I did think like, maybe should I do nursing first because it makes me more versatile? But I was like, I don't want to look after sick people. Where pregnancy isn't a sickness. It's a transient adaptation for women. And the majority of them, thankfully, are well throughout it. So I didn't really want to do the whole nursing thing. So I did direct entry midwifery. And I ummed and ahed for a couple of years. I was like, should I, shouldn't I, should I, shouldn't I? And then,
Couple of years.
yeah. While I was being ridiculous, partying. And then eventually I was like, right, okay, no, I can't get it out of my head. Like, I definitely think this is for me. I'd done a lot of research into it. I'd spoken to a lot of people. And that is how I went in that direction.
Nice. Okay, so entry base. Is it common field? Like, is it, or it's more rare to find school that is directly focused on that?
In the UK, yeah, every university will have a midwifery degree.
Oh, yeah?
Yeah, the numbers are generally quite small. The intake is quite small. It's one of the hardest degrees to get onto.
I was just about to ask.
Yeah, and it used to be funded by the government. So they want public healthcare workers, right? But now it's not. So we're seeing it's even harder for people to get into that profession. But because we have the NHS as it stands currently, don't know how long we'll have it. But
It's a National Health
Service.
Service.
So because we have that, you do get a lot of vocational jobs, vocational courses in our universities, nursing, physio, medicine, midwifery. So it is common in the UK.
And what do you mean thanks to that you get that? Like, I don't understand the connection.
What do you mean? What did I say?
That thanks to NHS,
Yeah.
you get a lot of these.
Because we have a national health service and it's public healthcare, it's free.
Okay,
So-
got it. Yeah.
We have to fill the slots.
Okay.
All these positions need filled.
So there is a demand
there's
for
a
that
demand
profession.
for the profession. Yeah.
Okay, got it now. Okay. Yeah, I always have this not problem, but my brain freezes because in these topics, because in Slovakia, like, there are private clinics and private hospitals and stuff, but like most of it is public and
Yeah.
it's free.
Yeah.
I mean, free, like you pay a
pay
fee
taxes,
and
right?
yeah, and some different
Yeah.
little fees when you come there and whatever. But generally, healthcare is free. So if somebody is saying like it's a rarity, then it throws me off. Okay, but the quality is very different. I can tell you that from
Okay.
UK. Yeah, yeah. No, like to a degree that you don't want to go to a hospital there.
Gosh.
Yeah, it's just underfunded, and specifically, even there are some funds coming, there is always somebody nibbing off
Yeah.
the funds, and it's just a disaster on school system, healthcare system is just not going the right way. So
The UK is not going the right way now anyway, so
yeah. But I mean, compared to, for example, US, right?
Yeah. Oh,
Where
yeah.
just
US
to
is-
have an insurance, which, for example, in Slovakia, you have to have a healthcare insurance.
Oh, right.
Like you have to.
Yeah.
Which is if I'm not mistaken, on a normal, general population scale covered by employee.
Right. Yeah.
So it's
So
not a
like
lot.
here.
Yeah. So exactly. Yeah. So it's not like a lot, but it's kind of part of what they deduct from your salary.
Yeah.
And it goes directly there. One is social, one is the healthcare, right?
Right.
But where the money ends up, that's a different story. Yeah.
It's always a different story.
Okay. So you went through that.
Mm-hmm.
Was the studying hard?
Yes.
Or let's rephrase it. Was it hard to a point that you start to question the choice?
No.
Okay.
I'm a bit of a nerd anyway, so I enjoy learning about. I enjoy anatomy, physiology. I don't mind writing an essay. I don't mind having an exam. And then the other side, it was 50% written, 50% clinical, and it just so happens that I enjoyed both sides. Clinical was good because it was like see one, do one, teach one. That was the mentality they use.
And also when you have a practical application, it's way easier to remember the theory as well, right?
Yeah, for sure. So I mean, it was challenging at times, but I enjoyed it. So it wasn't hard in that respect,
Cool. And you finished the studies.
Mm-hmm.
What's next?
So I got employed by the hospital that I was doing my training at.
Okay. So you probably had a good reputation there.
Yeah, well, enough to give me a job anyway.
Yeah.
So when you qualify, you have to do what we call a preceptorship, and you're basically going from that newly qualified level to that experienced-ish midwife. Usually within about 6 to 12 months, you'll do that preceptorship. And then it kind of just covers all the bases that your student time might not have.
Okay, so and that means doing the job with a supervision.
Yeah, with a little bit of, you're meeting certain goals. You're achieving this, and this, and you've got a bit of support there.
All right. Yeah. You know that in the traditional acupuncture, now I don't want to say this incorrectly, but I think it's something like the really, really traditional one. Yeah. In Japan or China or wherever it's coming from, you are allowed to work on your own after 60 years of practice.
Oh my God.
Under a supervision.
I want to retire at 60. No, but less than. Never mind.
Yeah,
that.
That's not 60 years of age, 60 years of practice.
How old would you be?
So basically
80.
but then the quality is a different level, right? Because you always have these old masters just basically throwing needles like a darts. And they really know what they're doing because they literally see anything possible.
Years,
yeah.
Wow.
Yeah, but probably works. Yeah.
Oh, yeah.
So if you see an acupuncture course online for 3 months, that's probably not it.
It's not the one. I want the 85-year-old man who studied for 60 years.
Yeah, and hopefully his hand's not shaking too much.
Yeah.
But I mean, come on, their average is coming to 100 now. So
True.
True. So they're probably well covered from that side
Lots
as well.
of working years left.
It's not like they're running out of them, right?
Yeah.
Because by the time they finish the practice, it's gone. They are gone. Okay, so for you, it wasn't 60 years of practice. It was 6 to 12 months?
It was, so I think 8 or 9.
8 or 9
in my
months?
hospital, yeah.
Okay.
By the time we finished it.
And that moment, you get big approved.
Kinda, but the second you take your job, you're just like, okay, go, work.
Okay. So it's not necessarily they're not looking over your shoulder all the time, and you already have, you definitely have responsibility, but you also have some kind of freedom, let's say.
Yeah.
Is there a lot of, there is definitely a lot of different approaches, but would it be to a point that you can meet a midwife you would absolutely not agree on some fundamental rule with?
It depends. So just like other courses, the midwifery degree is different in different countries. And some people will train to be a midwife in a private healthcare system. And in that respect, they're not autonomous practitioners. They're usually subservient to a OB-GYN or a doctor. Whereas in the UK, we are autonomous practitioners where we can practice in our own right. We can make decisions. We don't have to involve a doctor unless there's any concerns.
Okay.
So I wouldn't imagine meeting a midwife that had trained in the similar way that I had in a similar curriculum that I would resolutely disagree with.
Okay.
I do encounter some midwives that I disagree with, and that's usually just sometimes when they have their own children, they draw a lot from their experience, which can be really good. But that's anecdotal. But they will say, like, feed the baby every 2 hours. And I'm like, would you eat every 2 hours? Don't tell them that. Feed when it's hungry. And, well, it worked for my kids. And I'm like, that's great. Give them the option. It's not a rule.
Yeah.
So things like that, I guess I butt heads. And it's difficult here for people, for midwives, because we can't often say what we want to say anyway. So you find a lot of people going along with maybe policies that we don't agree with or that we've been trained to avoid.
Okay. Why you can't say what you want to say?
No, you'll get fired.
Okay.
I'm not even joking.
Okay, that's the...
If you're seen to be...
I understand that that's the consequence,
Yeah.
but I mean, like, more specific situation that...
You cannot be seen to be undermining the lead professional.
Which is the doctor.
So the UAE has got a lot of doctors from a lot of different places, and they will bring their own training and their own methods, regardless of international evidence or international guidelines, which we do have for maternity care. They will do what they know. So it's hard, you know what I mean? So we don't have best evidence blanket guidelines for maternity care in the UAE. We have Dr. Smith wants to do this and Dr. Jones wants to do that. And I want to do neither.
Okay.
Because it's not, I've been taught that actually neither of those ways are the best.
Or from your experience.
Or from my experience, and there's no evidence behind them. And I have a license to protect as well. So I have to be very careful how I then
present your side of you. Mm-hmm. I want to go into like how it practically works with like cooperation with doctor and how it is when new pregnant woman, usually woman, comes, right? But before that, now this can sound like a very dividing question, and I don't want to take it into like a racial stuff or anything, but do you find that the origin of a country of a doctor is also a determining factor in how much of a disagreement you can have with?
Yes.
Yeah. Okay.
Absolutely.
So, okay. We can keep it on that. And I'll say one thing that I heard, and this is, I don't know. I have the most minimal interaction with doctors I can. I don't go to doctors. It has to be something extremely, usually when I went to doctors or to some clinic here, it was because I was going with somebody. Like when one girl opened her head on the snatch and we had to go for stitches or something like that. I heard that UAE is very specifically filled with a lot of doctors that are the combination of two very bad factors. Let me explain. In India, for example, because they're a huge country, a lot of people coming from the system, right? The best from India will be employed or drafted to UK, US. They go there and they are working private clinics there. The second best, or let's say not the top of the class, but the second layer will end up in the private facilities in India. because they are very well paid as well. And then you have a category of people who still wants to get paid shit ton of money, but they're not that great. And they end up in Dubai or UAE. Which I don't know. I heard that this, obviously this is not everybody's case, and not every doctor who is here is in this category. But in general, I just found it funny because it seems pretty logical, right? Because, and this is not somebody I want to get treated by when the motivation is the money, but the credential is
and it's
not
hard,
the best. You know?
People can lie about their credentials, or they can, you know, if you go and if you want to find a OB-GYN, right? You Google it. Every single profile on Google is the best OB-GYN in the UAE.
I don't even know what...
Best OB-GYN, obstetrics gynecology.
Okay, cool.
Your baby doctor.
all right. Oh, OB.
Yeah.
Okay, now I got it. I thought it's some kind of product or something. Okay. I was like, oh, that's like a Zogastic kind of thing. Anyway, so yeah, exactly. Anything, wherever you Google it, and it applies to gyms.
Oh yeah.
It applies to restaurants. It applies to the best sushi, the best falafel, best traditional. And if it's not the best, it's the best Palestinian. You know, and you're just adding adjectives, that to a point you can't really argue that they are not correct because they are in their category the only one.
The only one, yeah.
Okay, so we would have this established. The interactions are not always, let's say, unanimous.
Yes.
Yeah, in the opinions presented to a mother. So there is a pregnant lady. Do you also work, or do you have some kind of? Do you advise people how to get pregnant, or that's
not really, not for
really.
me.
Okay.
I mean, I can give generic tips.
Okay, just
but like
have sex.
Have sex, really good start. More like if people message me on my Instagram, I will be like referring them to doctors that I know that specialize in that.
Like in case there's like fertility.
Doctors,
yeah.
Okay. But the good thing about like being a midwife is they're already pregnant when they get to me. That bit's taken care of.
Yeah, the checkbox. That checkbox is ticked already. Okay, so a pregnant. No, I just asked because like at what stage usually they approach you. That's why I asked.
I do get clients approach me for training when they're going through IVF or they're preparing for IVF. So that in that respect, I'd probably do a bit of pre-conception
IVF,
training.
in vitro fertilization.
Yeah, exactly.
Okay.
Yeah.
No, just making sure that we understand. Okay, so they approach you.
Yeah.
What is the process there?
The thing with people trying to conceive, going through IVF, they're advised to do low impact kind of training, if training at all. And there is no evidence that low impact movement and training is contraindicated in IVF, especially when going through the 2-week wait where they've had the embryo implanted. They've got to wait the 2 weeks to see if they're pregnant.
Okay.
But my mentality with these clients is if you're having IVF, you've generally had a long road to get there. You've probably had some like infertility, or you may have had loss. So I have to I would sit down with them and speak to them one-to-one and say like, okay, if we train and we keep it nice and light, so 60% area, and something happens, are you sort of willing to take that risk? It won't be because of the exercise. It will just be because most likely that IVF was unsuccessful. But I have to find out where they are mentally. Yeah. Like, because then would I take that risk? No, because I'm one of those people that would absolutely blame myself if something like that happened. And
you blame anything.
Yeah,
at
logically,
that point.
That's not right. But it's a very different headspace to be in. So preconception is very different.
Right? All
exactly.
The what ifs.
What ifs. And if you can't, if that's not something that you will be able to deal with, especially given the long road that a lot of these women have been on, and, you know, they need to talk to the partner about it as well, because it's not just one person having IVF, it's a unit, a couple. So it's kind of like, how does this sit with you? Tell me kind of from there what you think.
Okay.
So that's for preconception anyway.
And okay, so in that case, 2 weeks is not a great deal of training to be missed
It is
anyway.
not.
So
Yeah.
it's not a half a year.
It's not half a year, exactly. Yeah.
So in that case, like I would even say, just to be on the safe side, so I mean, just from my perspective, like I am always going by feel.
Yeah.
With whatever, I still believe whatever knowledge we can have, whatever experience we can have, we can see some stuff, we can feel from people. Yeah, you can see it on them, but it's their body. It's always there.
Yeah.
They will always understand themselves better than we will.
Than we ever will,
right?
yeah.
Even though that we could argue that some people are very disconnected, but
They
that's so
are,
different.
yeah.
But you can guide that, so you teach them how to feel better, right?
Exactly, especially in pregnancy.
Yeah.
You can really, that's the time where they really hone in on what's happening to their body, and they notice everything. Every little feeling, they will notice it.
And also for me, it's way different to talk about it as a male, because I think I'm way less perceptive to myself than any average woman. You know, like it's like, niggle there, this pain, whatever.
Yeah.
You know, like you just ignore.
Yeah.
Ignore. I would go crazy if I have to pay attention to everything.
Yeah.
You know, so especially given training and all that, you just roll with it.
Yeah.
And, yeah. But that's a different case in the pregnancy.
Yeah,
When
it is.
It's not only your responsibility for yourself, right? And there's way more in the play already.
Of course.
Okay, so a pregnant lady comes, and do you have some kind of like a limit at what stage you're taking them in, or how does this work? Like if it's 3 months in, 4 months in, 2
As
weeks
a trainer?
Okay, so what do you actually do with them? let's start with
Like
that.
from a midwife point of view?
Yes,
Yeah,
from a
okay.
midwife.
So they will see a midwife usually 5 to 6 weeks. So they've peed on the stick. They found out they're pregnant, they'll make an appointment. And your midwifery care, so all the evidence that we have around midwives shows that women who have continuous midwifery care throughout their pregnancy have better outcomes for mum, better outcomes for baby, more positive experiences, and less intervention, medical intervention. So ideally you see them from, okay, stick says positive, great. And then you make that first appointment. That's the booking appointment. We take their history, we find everything out, we do bloods. And then you see them probably about 13 or 14 times throughout the 9 months. Bit more spread out towards the start, because you're kind of just waiting for it to grow. Nothing really happens. And then closer together as you get closer to the estimated due date.
To prepare for everything.
Yeah, so every appointment is checking blood pressure, the protein in the urine, feeling the belly, listening to the baby, talking to the mum, what's happened this week? Have you noticed anything different this week? How do you feel? How do you feel mentally, not just physically? How's dad coping? Everything. It's like...
Is the room painted?
Yeah. Are you ready? Is your bag packed? Yeah, basically.
Yeah.
Have you got your snacks for labour? And throughout that, you would do the birth education slowly, bit by bit. And then... So that's the gold standard. What happens generally here is the women won't see a midwife until they go into labour.
Oh, really?
So between...
Okay, so what you described is like an optimal, ideal, the best case scenario.
That's how the care should be.
Okay, now, just if it happens this way, there is a pretty good chance that the lady doesn't need to actually interact with any doctor, right?
Yes.
That's
Except
the goal,
for
right?
when they go for their ultrasound.
Also, you don't do the ultrasound?
Midwife, unless they're specifically trained.
Okay.
We can get training to do that, but we don't. We usually send them to a sonographer or a doctor who is trained to do that.
And why is that?
Because it's a specialty all in itself. And when you look for things like fetal abnormalities on a scan, that's a scan that's a 20-week scan. So they do it 20 weeks. They check all the organs, everything. But that's a long scan. That's like 40 minutes.
Okay.
And that's just constantly looking at each organ, you know, and it takes a lot of practice.
Yeah. Oh, I get that. Like that's as you said, field on its own.
Yes.
I just asked because from, let's say, psychological perspective or psychological comfort perspective, it would be even better for the mom if she doesn't really need to interact with anybody else.
Yes.
Just with the
That's the goal.
midwife
Yeah.
who she has the trust with, right? Is it possible not to do the ultrasound, or now it's just like you have to?
You can decline. You don't have to do anything. However,
Even UAE?
the difficulty with private healthcare is that if you decline certain things and your doctor doesn't agree with that, they can actually just fire you as a patient.
So yeah, because you're a customer, right?
Yeah. And, you know, I've seen it. I've seen it happen to people that are 39, 40 weeks and they decline a induction of labor. And the doctor says, well, fine, I'm not going to be your doctor anymore. Very hard to then find another professional willing to take somebody who's ready to give birth any moment.
An induction means
Like inducing the labor, so starting
you
the
started
labor
like
off
artificially.
Artificially, yeah.
Ah, okay.
So
So you just because they declined it,
Yeah.
and they want to do it naturally,
Yeah.
the doctor fired them.
Yeah.
Oh shit.
Yeah,
That's
and
tough.
it can happen if they don't agree with your choices. Again, like we said before, not all doctors are like this. But the reality is, no matter where you are, nobody can make you do something that you don't consent to, especially in medicine.
Yeah, they shouldn't.
Yeah, they do. It happens,
but
and
the
it happens a lot, and people
But the
don't
fear is
realize.
a great factor on
Yeah.
that, right?
And
Because
it's very private healthcare is litigation driven, because your indemnity is not with the hospital here. It's you. So if a doctor, if something goes wrong, it's on them. It's on their shoulders. So that can be, it's like fear-based practice. Which is ironic, because if we did less of it, we'd probably have less bad outcomes from not intervening as much. So it's a vicious circle.
Yeah, because the doctors are feared that if you don't follow my procedures, which I believe are correct, I might be responsible, and I don't want that responsibility because I can be sued and I can lose whatever license and shit ton of money, right?
Yeah.
And therefore, they project the fear into people, scaring them to listen to me or there'll be a 100%. Problem.
It doesn't matter what field of medicine you're in now. This is just medicine in general, and it's how they talk about risk. Like, my favorite one, when you have a cesarean section, they stitch that scar, the wound back up. You have a scar on your uterus. If you have another baby, you can give birth to that baby vaginally, no problem. Less than 2% chance that the scar will open. So that's a 98% chance that it won't, which is pretty good odds. If I had a 98% chance of winning the lottery and a 2% chance of not,
you definitely buy the ticket.
I'd buy the ticket. But the way that then some physicians present that, it's a small risk. But if that happens, you and baby could die. Now, once you say words like that to parents, they're never unhearing that. Yeah. It takes a long time to unpick that work. So when that's said to them at 39 weeks, when they're nearly ready to give birth, that's it. And fate is sealed.
And at the same time, it's like, it's crazy because what the doctor is saying, technically, it's true.
Yeah.
It's 100% true.
100% true.
It's just the way it's presented, it's so misleading.
Yeah, very misleading.
Yeah, so it's inducing the fear of... Yeah. That's sad.
It is sad. That's why I get in trouble.
But we have you.
Yeah.
And you fight for people.
I try. I piss people off, but I'll fight for them.
Well, but if you fight something like that, of course you'll piss people off. You can't do revolution without some blood, right?
Yeah, absolutely.
Yeah. Well, we can hope for evolution, but it's just so slow to evolve towards that. Okay. So this is what you do in the clinic you work
Yes,
for.
yes.
Yeah, like and
So we're actually basically we will be the first clinic in the UAE to be working from a midwife only. So they will have their OB/GYN somewhere else, but they will see their midwife and we will do the whole start to finish in the clinic.
nice.
So they will always have a midwife as a point of care, even afterwards. So they come with the baby.
Nice.
Yeah.
That's very cool.
Yeah, it's very cool.
It's a very progressive.
It is. Well, I mean, we're
approach.
trying. Yeah. Trying very hard.
Yeah.
It is. It's really cool.
And just for the technicality of it, if somebody books you as a midwife or one of ladies, I assume, are they guys in this field?
There are, but just not in the UAE.
Okay.
But yeah, there's
For
quite a few
obvious
male
reasons.
midwives. Yeah.
Yeah?
Yeah.
Okay.
I think people find it a strange choice, but nobody concerns themselves with a male OB/GYN.
Yeah.
And I think it's because the word like wife is in there. I think that's where people's mind just explodes.
I was just thinking about it, like, why it feels weird
Yeah.
when you hear male midwife.
Yeah.
Well, because it says wife, right?
Yeah.
But it doesn't feel weird at all that there is a gynecologist,
Yes.
right?
Exactly.
Male, I mean. Well, but in UAE, male gynecologist is common, right?
Yeah.
But there are also people who don't want that.
Yes.
And they only want
They only
a
want
female.
the female.
Okay. Okay, so if somebody books you, you stay with them whole time.
Theoretically, in the labor, yes. In like the whole pregnancy, the labor, and then they see me afterwards as well. So
Yeah.
I'll be,
So it's not like, okay, so you came for this check or at 20 or 30th week, and Nikki's not here, she's not available, some other girl will see you.
yeah, no, it's
Because of the trust.
Yeah,
Yeah.
it's complete like continuity, unless I don't know, I'm on vacation and they say,
Of
yeah,
course.
do you want to see someone else or do you want to wait till I come home?
Yeah.
That's simple.
But she's coming in 2 months.
Yeah,
I'm due next week.
too bad. Yeah, so it's
You should make a t-shirt.
yeah,
Midwives need vacation too.
yeah, they do. I'll tell you. Too many vacations I need. So yeah, I mean, the ideal is to have a team, a small team, and the women know everybody on that team.
Okay.
That's the ideal because
So you can-
it's more manageable as well from a staffing point of view, from a like a resource and avoiding burnout point of view.
Yeah, well, that also makes sense, right? You have more opinions. You have
Yeah.
more support. You
support.
support each other
Yeah, 100%.
within the team. And if somebody is on a vacation, there is no like a stranger coming to the room.
Yes, exactly.
Oh, you think of everything.
We try.
Very well done. Oh, it sounds like I want to get pregnant now. Such a great
If you get
experience.
pregnant, we're going to make a lot of money.
Yeah, for sure. Yeah, we'll make a TV show out of it or something. Okay, then that's your work in the clinic.
Yeah.
Going through all this. In your other side, you also do training,
Yes, I do.
and that's like physical training, fitness training,
Fitness training.
for ladies.
Yes.
Okay. You do on top of it. This is like kind of on your own,
Yes.
in a air quotes free time.
Yeah, whatever that is. Yeah. Whatever that might
Well, it
be.
used to be free time.
So I do it in my free time. So I usually do it before. My mornings are usually full of clients and then I go to work.
Okay.
I tend not to do evenings or weekends.
All right.
For me, that's how I've managed to keep my sanity, I guess.
Yeah. Balance.
Balance, yeah, all about the balance. Yeah, so I do pre and postnatal training.
When you do that,
Yeah.
I believe that it's not just like, okay, but no pregnancy talk. We only train, right? Basically, you do the same thing.
I do the same. It's the clinic,
You
but
just
with
also-
some movement.
Yeah.
Yeah. It's like therapy sessions.
Yeah,
It's like a midwife consultation. So we talk the whole way through, which is great because a lot of the time they don't get the chance to talk to their OB/GYN because they have like 3 minutes appointment, very quick, very fast appointment. Doctors are very busy. they have the internet, but as we know,
So doctor can see you for 3 minutes,
Yeah.
but his lunch break is 1.5 hour, right?
if you're lucky, it's probably like 2.5.
Okay. Well, 2.5 minutes or 2.5 hours lunch. Yeah.
Hours.
Okay. All right. So let's go. I don't know how. Well, you definitely will have a crazy, complete, and very schematic system into this. Week by week or what, trimester by trimester. How do you? If we start with week 1. What is the training? Or I mean, you probably don't meet them at week 1 because nobody really knows.
They don't know they're pregnant.
Yeah, they don't know they're pregnant. But let's say week 6, week 7.
That's very
What
common.
what is different there? And then as you progress, how the trainings change, what you can do, what you shouldn't do, and maybe debunk some myths that go along the way. And now I'll just sit back and listen.
So I generally approach it trimester by trimester because every woman is so different that doing it week by week it's not one size fits all. So if we go by trimester, it's generally that little bit easier. Trimester 1, the biggest challenge is usually morning sickness, which isn't morning, it's morning, noon, night, 3 a.m. sickness, or complete nausea, like low level, high level nausea all day. So exhausting for them. Your body's working really hard at that point.
Why is this? Do we know physiologically why is
Hormones.
this? Hormones.
Yeah, usually progesterone.
Okay.
But it's hormone driven. And because that first trimester is when the placenta is being developed and it's embedding, and the amount of hormones we need, and the HCG, which is human chorionic gonadotrophin, which maintains the pregnancy, that gets higher and higher and higher. And we need all these to allow the placenta to embed into the uterus and to let baby start to develop. And this is also a time where they experience extreme fatigue. So if you kind of combine those two, which are quite common, it's quite a common combination, they're literally sick and tired. And that is exactly how they explain it
And
to
then
me.
you say it's a journey, it's not a disease, right?
Yeah, I know, right?
But it feels like one.
But yeah, exactly. The first trimester, that's kind of, they feel a bit rubbish. And a lot of women say it's like feeling hungover constantly. Like they don't know what they want to eat or drink. Most of them being able to only consume something salty, like French fries or a packet of crisps, and drinking Sprite or lemon in water, like anything. Anything that stays down is good.
Okay.
At this point. And a lot of women who are heavily into their training before and they're in the first trimester, they struggle a lot with it mentally because they're like, I need to train. I'm like, can you? I don't know. And I'm like, right, we need to take a step back. You need to be walking if you can. Swimming, do something that you can stop and just go and lie on the sofa. If that's what you need, you're literally growing a human.
Yeah.
So a lot of women beat themselves up in this first trimester because they're just like, I can't, I get home from work and I want to go to bed. And I'm like, so go to bed. Like, do that. That's what your body needs. So
I nap every day. I nap every day.
I nap every single day. Every single day. I love it. It's so good for you.
And you're not pregnant.
And I'm not pregnant. I'm just, getting on a bit. I'm just mentally, I'm just tired.
Well, you're pregnant 20 times because you're dealing with all these. Yeah.
So, first trimester, when they start to come out of that nausea, that morning sickness, that fatigue, it's usually around week 12 to 16. So we're going into the second trimester.
And that fades away.
It fades away for most women. Some women will have chronic, like they'll be sick the whole way through the pregnancy on and off. Some women develop hyperemesis gravidarum, which is vomiting in pregnancy to the point where they have electrolyte imbalance, dehydration. It can lead to like kidney damage.
Really?
Yeah, it's
that bad.
It's very, very severe. Very
That's
bad.
still
It's hospitalization. It requires hospitalization.
Still progesterone related, or
no, we don't know. We're
hormone?
not sure why some women get hyperemesis and others just don't. It's just like many things in pregnancy, we're not entirely sure where that comes from.
And what one in what, 100, one in 200? Do you know roughly?
I don't know.
Like what
Off
are
the top
the
of-
what
I
are
don't
the
know off
odds?
the top of my head, but I think it's more common than we think. But it hospitalizes most women. They need constant IV drips, but most women will come out of it. It'll fade away, and they'll come out of the other side, and that's when usually they're heading into week 13 plus, which is your second trimester. Second trimester is where women report they feel their best. When they look back through all the 3 trimesters, they're like, it was second trimester. Their energy levels come back. Their hormones start to balance out a little bit.
Is it maybe because out of nowhere they're just not feeling shit anymore?
Yeah,
Like,
they do. They yeah.
that's why they remember. It's like, oh, that was amazing. Because,
Exactly. They start to get up and not want to vomit, and they're like, oh, this is nice. I can have my cup of coffee. I can have my smoothie. I can have whatever. And I generally, for pregnancy, unless they have contraindications themselves physically, like any history that would, in a normal PT session, cause me to change my
obviously
training, then I train them like they're not pregnant until they give me reason to change that. So it gives me a good idea of how they move, how they perform movements, what's their like mind muscle connection like, what are their movement patterns, because as they get more pregnant, if I know them from that point, as they get more pregnant, that's when we start to tweak, as their bump starts to grow from like 22 to 24 weeks for most women first time.
It's 5 months.
Yeah
I'm just doing quick math.
Yeah, that is
I'm
quick
not. I'm not used to thinking
in
weeks.
weeks. Yeah, sorry. That's all I think in is weeks.
Yeah.
So I tend to train them like they're not pregnant in that respect, as long as they, like I say, they don't have anything that concerns me. And all I do is maybe tell them, it depends what sport they do as well and what their chosen method of exercise is. But we'll go for about 70% of like their max effort sometimes, like it should be maintainable. It's not full send, but it's also not, let's lie on the floor in Shavasana and not do anything.
I had a couple of clients who I ran through pregnancy as well, because they were so used to me.
Yeah.
And I had some kind of, like, definitely not this kind of education, but like I had some kind of education in that aspect as well. And my rule was always exactly as you said, 70%, which means 10 rep max or lighter.
Yeah.
That's roughly your 70%. Yeah. If you can't lift it for 10 times, why? Why would you? Leave it, that will be for later. No testing 1 rep maxes or anything. We don't need the water broken on the class, right? And cardio wise, it was the talking test.
Yeah.
You always have to be able to answer with a 1 fluent sentence without gasping.
Yeah.
And that's your 70% effort. Yeah. And that's pretty much...
Yeah, it's a really solid baseline for anyone. If they don't get their own PT for pregnancy or they don't have that knowledge there, 70% you can, if you wear a sports watch, you can find out what your 70% looks like in numbers. You can do it through talking a sentence. You can do it through, okay, I can't lift 8 of these, never mind 10. I need to rethink what my 70% is.
Yeah. You said one interesting thing, or you hinted it, that you adapt to whatever they are doing, whatever they choose to do. So basically, it's not like... hey, I'm Nikki and I'm doing this amazing pregnancy training for you. Yeah. You basically take whatever they are doing or were doing before and you just help them to adapt that to the pregnancy regime.
Exactly. I've had a few clients who are come to me pregnant and they're triathletes, serious triathletes, and they're like, I want to maintain. And I'm like, you're not going to maintain, you're pregnant. You're not maintaining anything. Maybe an appetite. That's about it. Yeah. You can't. And a lot of that's a misconception. A lot of trainers are like, oh, we'll maintain your muscle mass and I'm like, no, you won't. You absolutely won't. Don't lie. Don't set them up for that failure and that disappointment. But for example, the triathletes. So I got input with a swim coach to help them tailor their swim sessions to 70% because some of them were just a bit like overachiever. Athlete brain is switched on firmly and they cannot get out of it. So, and then, you know, cycling, great for pregnancy, great on the joints. Like it's brilliant. And things like, okay, we'll do strength training that complements your running. I generally, past 20 weeks, I don't think there's much point in running.
For the load?
Yeah.
For the impact?
Oh, yeah. Your pelvic floor is just like every time you run, it's going out.
Okay,
like,
so pelvic floor.
Pelvic floor, knees, hips. When your center of gravity moves out with a bump, you then start to run in like a not ideal posture.
We ran this study on the university when I was studying. Well, like I didn't run it, but I was around, and they had this. I just know because I was trying them on. It was this. I think it was like an insole into the shoe.
Yeah,
and it had on the surface of one insole there was 40,000 sensors. Pressure sensors.
Wow.
And they were inviting these pregnant ladies who were basically walking for like half an hour or 15 minutes. I don't know what was the time protocol every week. And they were basically observing how how pregnancy and that shift in center of gravity is influencing the movement pattern of the walking and how they plant the foot and where is the pressure and if there is a potential for developing certain imbalances for, you know, more pressure on the outside, more pressure on the knee, whatever it is, or flat foot, you know, like foot collapsing, and then some of them possibly were also supporting strength training. So you see the difference if it's happening or not. So I don't know the results of that, but I found it very interesting because like something you don't normally think about, but just walking changes massively, right?
Absolutely. Everything changes in pregnancy. And that's like, it has to. It's fine for it to change. It's just that we need to support it the best way we can, especially with things like training. There are so many people out there that have had a baby, for example, and then train other women. Having a baby does not make you a trainer. It's like, I've been on a plane, I'm not a pilot. You don't want me flying your like Airbus to Spain, do you? Just because I've been on one. And it's hard because the level of education that we provide for pre and postnatal coaches is diabolical. It is so poor, and it's like half a day or a day course.
And you get certification, yeah?
Yeah. A level 3, a level 3 personal training, level 3 or something like that, or a level 4. I don't know what level it is, but as long as reps have accredited we're winning. But honestly,
reps is the best measure of
apparently so.
Yeah,
of bullshit.
Yeah, well, I mean, but it's for business perspective, it's fucking brilliant.
Yeah,
it's like I will come and I'll establish a company that will unify quality of food in restaurants by my standards.
Yeah,
I'll measure
that's exactly it. Yeah,
I will measure content of food, content of salt in the food, and based on how I like it or not, I will just approve or not. It's like this is.
Yeah, so we have a lot of cowboys. Best way to put it.
Yeah. So you dealing with bad coaching and
I think it's like greedy coaches. Like, I'm going to do pre and postnatal because there's
like this, or like specifically specializing in that.
Yeah.
Oh
yeah.
But I mean, you know, come on, like I know you don't see it that way, but like they're not a competition for you.
No.
Because like, come on, you know, with everything you know.
They're not.
Yeah, because like, okay, so you want to train pregnant people.
Yeah.
Who do you choose? A trainer who did weekend course, or a midwife of pregnancy training, or a midwife who did a training course.
Yeah.
You know, like that's a no-brainer, right? Like,
you would think so.
And yours wasn't probably a weekend as well.
I did the training. I did the reps one, and then I had to
go. The reps
one? I had to, for where I used to work.
Oh, okay.
And then I went and did a proper one from a woman in the UK called Jenny Burrell, and she's focusing on prenatal and postnatal training. She's a physiotherapist.
That helps.
Yeah, it always helps. They're the people to know in pregnancy.
Yeah.
So
Yeah.
I had to go and do other study because I just thought this isn't enough.
Like I mean, I don't want to even talk about the quality of coaching.
Let's not get into that.
Yeah,
God, we'll be here all day.
Because that's also regarding injuries and and the anti-aging coaching and all the other special categories. Anti-aging, just stop aging. Okay. Anyway, so you train them, and then through the second trimester, and then what is the change that comes on the last trimester?
So the third trimester, the fatigue can come back. They're heavy. They're carrying a bump. They're carrying a baby. The baby then starts to grow quite rapidly towards the end of birth, putting lots of fat layers down, and you're always going to be towards your heaviest. That you're going to be in the whole pregnancy. That puts a lot of pressure on hips, joints. A lot of pregnant women get sciatica. They get tailbone pain. They get pubic bone pain. All of these things then can make training quite difficult. So in the third trimester, we've been hitting 70%. Great. In the second trimester, that's the time to really kind of try and draw back some of that enjoyment and that intensity that you feel when you do a workout pre-pregnancy. That's when we're trying to emulate that. For the third trimester, we're kind of scaling it.
So it's like you peaking in the second one.
Yeah, exactly. It's exactly what it is. Temporary peak. And then in the third trimester, the way I train is we just do a lot of strength training. I'm not bothered about your heart rate increasing. You're going to walk up the stairs or bend over to pick up your shoes. Your heart rate's going to go up, right?
Yeah.
I know that already. What we're thinking about now is that mind-muscle connection and maintaining those movement patterns. That's it. And doing a lot of unilateral work because the pelvis is such a mobile structure. And we know that actually the more we move and manipulate the pelvis, the more likely the baby is to get into a better position.
Oh, okay.
So it helps
hip
the baby.
movement.
Hip movement. Oh my God, hip movement is the one.
Okay, what would that be like? Hip thrusts? Or,
I would do things like split squats. A lot of rotational work is good.
Okay.
Step ups, lateral step ups, brilliant for causing.
Well, you're also opening the hip.
Anything
which can be helpful.
Absolutely.
At the end.
Yeah. So anything like that, it's almost like the last trimester is right, we're preparing for birth. Because I want, if women want to give birth in a certain position, like squatting or all fours, my goal is to make sure they can still be comfortably in that position when they come to the end of the pregnancy. And they feel like even though they're in labor and they're having their contractions, they can still mobilize. They can still move well through that.
Because they're used to it.
Because they're used to it. Because they're used to
crawl.
Yeah. Spending time in those positions.
What about relaxing? Are you concerned by...
No? Not really.
So that's bullshit.
Because I would
that's
never...
I know it releases.
There.
Yeah.
Have I ever had a problem with it personally? No.
Just to clarify, what I'm talking about is that there is some experts, I don't know, are claiming that release of relaxin because it's released pre-labor, right?
Yeah,
so
the body can stretch.
So the body can stretch, the hip can open more, is potentially dangerous in training towards the end of the pregnancy because it's the levels are already elevated and therefore you are more prone to the injury.
Yeah. That, for me, I would say that is more the responsibility of your trainer, because how is my client going to get injured if we've trained well throughout the pregnancy? All we're doing is adapting for her third trimester. We're adapting things we've already done. So whether we shorten the range of movement or the time under tension or we take away
wider stance because of the belly.
We take away the weight, and
Yeah.
she does body weight because she's carrying an 8-kilo ball on her stomach. Like, there's so many different things that you can do to the exercises you've already been doing. So when people get injured, generally, I find that it's because they or their trainer hasn't scaled their workout appropriately or their training appropriately. Just because, you know, you probably can, some people can lift 100 kilos, deadlift.
Most people shouldn't try.
Yeah, but why would you want to?
Yeah,
like,
right before the...
Yeah, like what? Why? That's proving something to yourself. That's nothing else. And there's...
Or trying to induce the labor.
Yeah, or trying to induce the labor, yeah.
When the pelvic floor is not ready.
Yeah. And I mean, it's hard because they see CrossFit athletes are terrible for it. The top 1%, but they're doing like toes to bar. And I'm like, this is fine. She's obviously got a lot of people supporting her and she's got a big team. You're not in the top 1%.
Yeah, like, of course, if a CrossFit Games champion will be doing toes to bars or thrusters in her 9 months, she's not doing it with anywhere close to intensity.
No,
or
for her.
For her.
Exactly.
Yeah, anywhere close. Just because that's your top intensity, what she's showing.
Yeah.
That's not her top intensity.
And I find it's a lot, sometimes it's like trainer ego as well. So
Trainer?
Like, so I'll see like Instagram reels. And it's like, oh, here's, I don't know.
Amanda.
Sarah, Amanda. And she's deadlifting 70 kilos at 37 weeks. Why? Tell me what benefit that is going to have on her versus what the hell it's going to do to her pelvic floor and her diastasis or her... Yeah, anytime that you have to... like lifting up 70 kilos at full term, they're probably going to be bracing in some way. Where's
brace.
That? Yeah, exactly. Yeah. Where's that pressure going? It's only ever going to go one way, and that is down.
So you're not endangering the baby itself?
No.
Okay.
But, you know, mum might pee herself for the rest of her life.
Yeah.
Which is worse.
Yeah.
Jeez. Baby's tucked up in there, living its best life in the waters.
I've seen, maybe you posted it, a mom laughing, effect of a mom laughing on a baby in her belly. And it was on the sonograph.
Oh,
it was like a picture of like how
it's cute.
how it's influencing the baby when the mom laughs. And there was also of course like a lot of written stuff about endorphins going on and like all the dopamine and happiness out of whatever is happening there. But yeah, it was like I looked and it looked like a pretty big shockwaves to the baby on the first sight, you know. They're saying it's actually helping and relaxing.
Yeah.
But when I saw it, I was like, oh shit, it's some
aggressive
earthquake there, you know. Yeah. Okay, so when you prepare them for this labor, do you specifically focus on some breathing?
Yeah.
In the training?
So right from the start, whether you have a trainer or not, you should be practicing diaphragmatic breathing. And this also helps them in labor. So if we do it from the very start, what we expect to see is engagement of their abdominal muscles, especially the TVAs, and engaging the pelvic floor. Obviously, we can't see that, but usually if they describe it to you, you'll know if they're doing it right or not. And I advise that this is how people warm up. So in different positions, we're doing 5 diaphragmatic breaths. You can see when someone's doing it. I have them put their hands on their waist. Yeah. So your fingers get closer together as you exhale, further apart as you inhale, fill the belly. And this is then the breathing that we take throughout the training, because we use that breath to move, whether it's move the weight, move ourselves. And that's how I tend to train the women.
Well, this to a certain extent is also how bracing should be happening.
Exactly, yeah.
It's nothing super new.
It's not new.
It's just so many people don't know.
The only difference is that we're just not tense, like holding.
Yeah.
Breath. That's it. But in the postpartum, that if once I've, especially when they've trained with me in the prenatal period, when they come back, they're able to like switch on their core and identify their pelvic floor sooner than women who haven't practiced the breathing. No matter what their mode of birth, whether it's C-section or vaginal birth, doesn't matter.
For me, breathing equals awareness. Always.
Yeah.
Because that's how you build awareness. Reversing the breathing, doing concentric on inhale or concentric on exhale.
Excellent.
You know, like you can just play with it and you will see how many different ways of training there actually are, in contraction and all that.
And like diaphragm breathing, when you're training somebody and they're practicing that, they can use that in labor to push. So a lot of people will tell you to hold your breath for like 10 seconds and push down. Awful. First of all,
I would pass out.
People are going purple.
Yeah.
It's really like worrying. You're like, breathe, breathe, breathe. Take a breath. But actually, if they have really good control with their breathing, you are able to what we call down breathe. So on the exhale, we're contracting the core and we're pushing with the pelvic floor. So actually down breathing is really useful for the pushing stage of labor. So if you're doing breathing throughout the entire pregnancy, for birth, so useful. For postpartum, it's an integral part of rehab anyway. So.
Okay, let me ask you one more thing about this. When we're thinking about this postpartum, and because you mentioned the whole pelvic floor and peeing and all that, can you explain what it means, what is happening, how to prevent it, potentially even if it's already happening and it's, let's say, the prevention wasn't great, what can we still do about it?
Yeah. So with postpartum, what we generally find is that women will have their diastasis in their stomach, which diastasis recti, which is the separation of the abdominal muscles.
So basically the front wall, the six-pack is separated to left and right.
Yes, and that has to happen because you have a bump. Your abdomen has to stretch.
Because it's expanded.
Because it's expanding, because baby is growing. So that's unavoidable. That's going to happen to some degree. And the reality is we don't know what people's baseline is either. Nobody checks their pre-pregnancy
diastasis.
Yeah, some people naturally will have 0.5 centimeter there.
My brother has it.
Yeah, and that's something that then actually, if you're 1.5...
was never pregnant.
Yeah.
Not even once.
Oh, good. And from the minute you're pregnant, and your baby starts to grow, the weight that your pelvic floor is exposed to and the pressure from carrying that weight around just gets exponentially bigger until you give birth. If you give birth vaginally, that's added like stretching and pressure to the pelvic floor. Even if you give birth by cesarean section, you've still carried that baby for 9 months. That pelvic floor still needs fully assessing. So the reason I mentioned peeing yourself is because there's a high number of women. Most women will experience some sort of pelvic floor dysfunction, whether that is for a day, a week, a month, or 10 years. We now know that actually our parents' generation, for example, and the generation above them are really suffering from it because women's health, women's pelvic health was not of interest to anybody when our parents were having us and their parents were having them. So we actually know there's a large number of women suffering with this.
If you would, just so we can make it clear, I kind of know, obviously I haven't experienced it myself, but what kind of sensation that is when you say like feeling the pelvic floor? Like how would you describe it?
Yeah, I mean men have a pelvic floor.
Yeah, I know.
So I don't know.
I know how to feel it.
Yeah.
But I'm just curious, like, how would you describe it?
So the best way I can describe, right, for women to find their pelvic floor is, imagine you have a smoothie or like a thick shake, right, a milkshake.
Okay.
Yeah. And you're trying to suck it up with a straw. Imagine that straw is in the vagina. And what we're doing is you're using those muscles around it to draw up and in.
Pull in.
Pull in. It's like you're drinking that smoothie. That is the trigger that I find it works the best for most of my clients.
Okay.
And it's just like that contraction of those pelvic floor muscles. And there's a lot of pelvic floor muscles. And you've got one that's in a figure of 8 around the vagina.
That's tricky.
And the rectum. Yeah.
Oh,
so that's
like
why,
double wrap.
Yeah. Yeah, exactly. Okay. And that's why women who contract their pelvic floor will feel it at the front and they'll also feel it at the back. Mm-hmm. So it's like a clench.
Clench.
But not clenching your butt cheeks. It's the muscles that are engaging.
The inside.
Yeah, it's the inside.
Inner clench.
It's almost like it's going in and up.
Mm-hmm. Okay, so you get the sensation or, yeah, you can suck in.
Yeah.
Now, how do you strengthen it?
So, like the diaphragmatic breathing, what we do, especially postpartum, is with women, diaphragmatic breathing should always include your pelvic floor. Always. When
I was learning about core,
yeah,
from more like physio / training perspective, not pregnancy related. I was always told, imagine a tube.
Yeah, the cylinder.
Yeah, it's a cylinder.
It's
Sides is obliques.
Yeah.
Back is the multifidi.
Yeah.
Front is the transversus abdominis.
Yeah.
Top, the lid is the diaphragm, and the bottom is the pelvic floor.
And that is the single best way people can be taught.
Perfect.
Honestly, you don't learn that.
That's how I was. Yeah, I'm not surprised.
Yeah.
This is how I was always explaining the breathing, the bracing.
Yeah.
Yeah. The pelvic floor is probably the trickiest for people to get a grasp. But now you might tell me that this is a stupid thing, because it might be a little bit different, but especially for men, I don't know if this is for ladies as well, but when you pee, not everybody can stop it on a command.
Yeah.
Yeah. And I was taught that this is one way how you can strengthen it. When you pee, you stop.
Yeah.
You pee, you stop.
That is something that is still advised today. Whether it has much merit behind it, I would personally not recommend that. For women especially, right? Starting and stopping your pee, it's a dodgy game. Like, why are we doing that? Why are we keeping pee in there? Not ideal.
But not like
not constantly.
Like,
but like
it's like you stop and because not like leave for half an hour. It's just like for that moment. Yeah.
To
like I'll be back in an hour.
Yeah. I'll be back. To stop pee coming out, it's not the same movement as an actual pelvic floor contraction.
Good.
This is why
this is the answer I wanted.
Yeah, we don't recommend it. And Kegels, it's a Kegel, that pelvic floor contraction, but they're not bad. They're useful. But the reality is they're kind of down the list in the spectrum of what is going to help you.
Okay.
So the breath work is the core of everything. If you know how to breathe and engage that cylinder, we're moving on to compound lifts. We know that they're going to do what they need to do without doing direct core work, especially if you've had a C-section. I do start my clients on their core rehab from 2 weeks after vaginal birth, 3 weeks after C-section.
Okay.
Early.
That's pretty
earlier than
solid.
most people are happy to do, but I don't know if that's maybe the midwifery side of me. I feel quite confident in the fact that these women are,
especially when you know them, right?
Exactly. And it's also not, we're not doing a CrossFit class. We're on a mat with a Pilates ball and breathing.
Yeah, it's not like you carrying 100 kilo sandbag. Yeah.
It's pure rehab.
Yeah.
And the thing about postpartum training that especially athlete brains hate, postpartum training is boring. It is breathing, slow movements, controlled movements. Even when they start to feel great, I'm like, yep, but we're not doing that quite as controlled as I need you to be before I let you do this. And a lot of people get really stressed about it.
Have you heard of vaginal weightlifting?
Yeah, I can't even deal with that.
No?
No.
Okay. I know a lady who has a world record, but it's like...
What is it? What is the record for vagina weights?
I think it was around like 12 kilos or something like that.
So she's got good pelvic floor muscles.
Well, that was the whole idea for her. And it's not like she's recommending anybody to do it. And also the world record, it's in a meaning that she didn't find anybody else on the internet who did more.
Yeah.
You know?
Fair enough.
Yeah. And I don't think there's many people actually being involved in this discipline, right? But she was doing it. She did a lot of breathing. She can do the belly waves,
Yeah.
you know, all the Indian names of it. I don't know the names, but, you know, like belly waves and the vacuums and all that. So like she has amazing control. But she also has the Venus eggs. Is it called? Yeah. So she has the Venus egg that has a little string on it, and she hangs a kettlebell on it and she holds.
Yeah.
And lifts, and then lifts and holds.
Yeah.
So, okay, ultimately, that's very strong contraction.
Yeah. That's not always necessarily a good thing for women.
Yeah, so I would say, okay, definitely it's not necessary to be to that degree.
Yeah.
Do you think it's possibly harmful as well?
The thing is, we know that a lot of women have a weak pelvic floor after pregnancy and birth. So hypotonic. We actually know that a hell of a lot of women have a hypertonic pelvic floor.
Too much tension.
Too much tension. So that's why when we're talking about pelvic floor and postpartum rehab, a lot of trainers will just be like, right, do your Kegels. The last thing you want to do to a hypertonic pelvic floor is give it more tension.
Yeah.
And that can cause, so having too much tension can cause very similar symptoms like incontinence, pain during intercourse, pain on movement during like whatever. It's the same as the weak pelvic floor. So a lot of the symptoms can often look and present the same. So I will ask every one of my clients to go and see a women's health physiotherapist before we train.
Okay.
If there is a waiting list, I understand that.
You know Selena?
Selena.
She's women's health physio. She used to be at DISC. I don't know where she's now.
What's her Instagram handle?
Selena Bicho, I think. Anyway, she was here. We're talking about this a little bit as well.
Yeah.
Okay, I will have now... I know it's probably not that simple to answer what I will ask, but try to like keep it extremely... not necessarily short, but like a clear answer, as clear as possible. Yeah. So there is a possibility of having hypotonic or hypertonic pelvic floor.
Yeah.
Both of them are problem.
Yeah.
Good. Yes. We got 2 yes for now.
2 yes.
Now, how can you recognize it? Or can you recognize it on your own and kind of self-diagnose?
You can self-diagnose that you have pelvic floor dysfunction by the symptoms. So like I said, the incontinence, the pain during intercourse, maybe you're trying to do functional movement again and you're finding there's a bit of pain, maybe down one side. You might have tailbone pain. Things like this are all indicative of pelvic floor dysfunction. It is absolutely the job of a physio to tell you what kind of dysfunction that is.
Okay.
Because
so you need somebody who really knows to look at it.
For me, a physio in this respect is non-negotiable.
Okay. Yeah, that's what Selena does, by the way. So she really knows.
The best money you'll ever spend.
Okay.
Because a good physio and a good trainer, like the physios will talk to me and they'll say, right, I found this, and this. I recommend this. Can you work it into your program? that is what we want. We want that collaboration between professionals. That's how you get the best outcome.
For sure. Nice. Okay, then, and now this is maybe just to like briefly outline what you do when you have hypo and what you do when you have hypertonic pelvic floor.
So
I believe the physio will tell you.
Yeah. Oh yeah.
What specifically, but
hypertonic
still.
is we need to learn how to relax the pelvic floor. So when we think about diaphragmatic breathing and we're doing a big inhale, filling the stomach, that's when we're focusing on the relaxation and the dropping down of the pelvic floor. Some women need to use things like a cushion or a roller, foam roller, a ball, something like that to help them, like a prop against their pelvic floor to help them
like to
push down against it. Yeah. And something like that can be really easily done. So relaxation techniques, physiotherapists will do a lot of manual release as well.
Like a massage,
Like
basically.
a massage, yeah. And then for hypotonic, we're thinking about strengthening. So we're thinking about causing these contractions by whatever means necessary, whether that is with a band, a ball, with your breathing, with your dumbbells. And once you've been to a pelvic floor physio, they tell you, actually, there's a big imbalance to the left. So if you know you're having symptoms, you don't necessarily know what part of your pelvic floor is causing those symptoms. So how you would treat it depends on the origin.
Okay. So, well, you have to go there anyway.
Honestly,
Either way,
if you're going to get PT postpartum and you can afford that, you can definitely afford the trainer. That's where the physio, sorry.
The physio.
That is where your money is going to be better spent.
And it's
Not doing myself out of jobs here, but it is.
And it's for life.
And it's for life, yeah.
Because if you fix this in 3 months, maybe, like you work on it.
I would say.
Okay, maybe you don't
9.
fix it, but you get the awareness and you know what to work on.
Yeah.
Like you don't necessarily, you don't fix it in 3 months, but you
Improve
learn
it.
how to work on it. And that will also, I assume, the peeing is hypotonic symptom.
Can be both.
Can be both. Okay, so it's a dysfunction.
It
basically.
is, yeah.
Okay, a peeing means what we many times see with many ladies who maybe gave birth 30 years ago or 20 years ago, but they do a little bit of box jumps or they do a little bit of skipping rope and they have urge to pee.
Yeah.
Now a little bit hardcore story. My brother was judging CrossFit Games, the Masters division, and they were let's say the older categories, okay, that might be 60, 65, 70 plus. I'm not sure how far that goes, but there is many of them always by 5 years. And they had some double unders in the workout. There was a literally crew, staff, running with towels and cleaning the competition floor from pee. And not in one case. It was like a shit show.
Yeah. Piss show.
Piss show. Yeah, so that's and it's not only the discomfort of it in that meaning or the public humiliation, but it's so unhealthy to be in that kind of state, you know? So it's not like, well, I don't skip, so it's fine. Or I will not skip, I will rather do assault. Well, that's not the point.
Yeah.
Point is to have a healthy body that can...
Yeah, well, if
you can skip.
You want to go on the trampoline with your grandchildren. You don't want to pee on them while you're on there.
Especially in that height, right?
Yeah, you need your pelvic floor to be as functional as your hands, arms, legs, knees, neck, every other part of your body that you would expect to perform. You should have that same expectation of the pelvic floor and invest in getting it there.
Very well. Nikki, forever and always we can go through like the myths that really piss you off the most because there is a long list, I know.
Yeah. Oh God. So many things piss me off.
But for now, flying with a child, flying through the pregnancy, what is your opinion and experience?
It's absolutely fine unless you have been told specifically by your doctor there are contraindications. If you have a history of deep vein thrombosis, blood clots, that can be a risk factor. But generally, for the wider population, the reality is we have to travel. Some people travel for work. Some people will be pregnant and think, I'm not staying in Dubai when it's 45 degrees. I'm going home.
Yeah, I understand
It's
that.
safe.
It's safe. Okay. Even through any stage of the pregnancy?
Yes, until the airlines have a cut-off. The airlines will generally, from about 34 weeks, not be that happy if you're flying anymore. That is just because you're coming up to the time where you could potentially give birth.
Yeah.
And they don't want to have a baby on the plane. Understandable.
Yeah. How can they? But can they legally or
I don't think so.
kick you off?
I mean, if you just had something loose on, do they know how old you are? Like how far pregnant you are?
Yeah.
I would fly in my pregnancy if I was low risk and had no complications.
So the fact, because of the pressurizing, right, and changes of the pressure. Not expert on this at all. I just know that when it drops, the plastic bottle will be completely sucked out of air. Mm-hmm. Yeah, when the plane is landing, so you can really see. And imagining that the body is 70% of water, and like that kind of pressure is applied to the liquids in your body. I'm not saying that your baby is getting squished there.
Yeah.
It's just for me, or my opinion is that unless it's necessary, I would avoid it.
I wouldn't say travel if it wasn't necessary.
Okay.
Just because when you're pregnant, things can change for you day to day. And, go on your baby moon or go see your family before you give birth, whatever.
Or some people, especially from here, they go to deliver.
They go to deliver in their home country, yeah. But on the whole, it's safe.
So generally,
the baby's very well protected in there. There's 7 layers between the outside world and the baby.
Okay.
And the amniotic fluid plays a part in pressure control anyway.
Yeah?
Yeah.
Oh, nice. So basically a baby has its own pressurized cabin.
It's like a decompression chamber. It's insulated.
Nice. So overall, also from literature, studies, from experience, there is not really any cases, or there probably will be, because there's are cases in everything. There's always something. But you don't know about anything super tragic that happened unnecessarily just because of the flight.
No.
Okay. Cool. Let's shoot.
Myths. Oh, myths. Exercise causes miscarriage. That's a massive myth. And it's still told by doctors here today. It is so widespread. And it's generational belief as well. Mm. It's absolutely not true. But the threat of that, the thought of that is enough to scare people into not moving for their pregnancy, which we know brings a different set of concerns.
That's even bigger risk, right?
Yeah.
Or
diabetes or,
because it's not only in the pregnancy, right? Mm-hmm. The first answer, because how much doctors are trained through their studies in physical training or impact of physical training on body, or even nutrition, right? Because they are taught what liver does on molecular enzymatic level. And I'm not like, they know everything super well, but they're extremely focused on not functioning, on pathologies. Yeah. They're trained in pathologies, not necessarily in health, right? So I found this, I had this crazy case where one of my clients, because of COVID, he stopped coming. I mean, laziness between us, yeah. It was a good excuse not to come. And he was pretty much sitting for 6 to 8 months on the couch at home. And his lower back started to hurt. I don't know why, right? So he
knows?
went to the doctor, and his doctor, this older practitioner, he was like, "You have to strain yourself less." he was, he was,
Lie down.
he was
Don't
a
even
li-
sit down.
he was literally lying or sitting most of the day at home because he's working from home as well. So sometimes he went to like office or something, but pretty much in front of a TV on the couch or in front of the computer whole day. And he told him that he needs to strain himself less.
Yes.
That's when he restarted
Yeah.
and started to come again because he realized that there's something not
not
playing
right.
well.
Yeah,
Yeah.
yeah.
So yeah, it's not probably only in your expertise that they
It's not.
they know so little about it that they rather recommend not to do anything
Yeah, exactly.
just so there is no risk.
Yeah. Which is rubbish.
Yeah, because the logic, if you don't do anything, nothing bad can happen. But it only goes so far because
It
not
does.
doing anything has its consequences
It
as
does,
well.
yeah.
So I wanted to ask about the diabetes because you mentioned it a couple of times.
Yeah.
So can you explain that a little bit more? Why it's happening, how it's happening?
So a lot of women develop gestational diabetes. Some people we know are predisposed to diabetes. Maybe they have a family history. Maybe they've had it in previous pregnancies. Maybe they're pre-diabetic anyway, and then they get pregnant. Maybe they're overweight. But also your placenta releases insulin-suppressing hormones. So
So that's why.
even if you've got no family history and your nutrition is on point and you are the healthiest person in a 10-mile radius, that your placenta is still releasing these insulin suppressing.
And what are those hormones?
Can't remember the long name of them now.
Okay.
But basically,
Okay, and but what is their main purpose? Do you know? Because they're
It's-
probably not
yeah,
there to
it's-
suppress insulin, right?
no, it's to do with like facilitating placenta growth. So and energy.
basically it's like-
we do need glucose. We need
Yeah.
quite good high levels of it at times. However, it doesn't just turn off. And for some people, we don't know what their baseline. Again, it's all about these things that we don't know about ourselves. What's your baseline? If my baseline insulin is quite high, I can afford to then take that hit from those hormones that suppresses my production, and I won't develop gestational diabetes. Some women have a lower threshold, and they find themselves being pushed into the diabetic.
But when we go by one, type 1 diabetes is your beta cells in pancreas are not creating insulin or in a very limited amount or in a so low quality
It's not.
that it's not working.
Yeah.
It's basically non-functional even it's created. Type 2 is that you develop, that's the most common one, that's the lifestyle one, yeah. That's when the cells in the tissues, muscles, whatever it is, where the glucose is supposed to be used, become desensitized
Yeah.
to the insulin. So in this case, there is not necessarily lack of insulin
No.
or desensitized tissues. It's that there is some extra hormones
yeah.
that are created for the purpose of creating placenta that are suppressing
Yeah.
the effect of insulin.
Yeah.
So therefore, if that goes away,
Yeah,
it comes back and
yeah,
everything's
gestational
fine.
diabetes is transient.
Okay.
It will go.
But it still can show and predict the type 2 diabetes later in
It
life.
can, yeah.
Yeah.
Yeah, it's an indicator of that. And it's very prevalent here.
Yeah?
Yeah.
Last couple of years, yeah. Well, I was reading some statistics about obesity and diabetes in the US in last couple of years, and it's fucking crazy.
Yeah.
Like they are really going to a limit now of
It's just doing
70% either overweight or obese in US.
and one of the worst healthcare systems available.
And education is probably not doing great.
No.
Well, that's why we're here. So, some other myth?
Other myths. There's a pregnancy myth that drives me mad. And it's that the baby moves less as you get closer to the birth. People say the baby's not got so much room. so the movements are less. And, well, no, that's just stupid. I don't even have an answer for that.
And why even that would be a true? Like, what is a problem?
Well, any baby that moves less is telling us it's not happy.
Oh, yeah?
So babies' movements are the best indicator of their well-being.
Okay.
And babies develop, from 32 weeks, babies develop a pattern of movements. So you'll know that, like, oh, I have my dinner, I lie down in the bed, and the baby starts going crazy. And then after I wake up and I train and I have my breakfast, the baby goes crazy. So mums know really well this
they
pattern.
tune into your regime,
yeah? Sometimes. Sometimes they do the opposite and wind people up.
Okay, so would that be suggesting that it's good to have a very, let's say, monotonous or very regular regime?
Yeah.
So that would be beneficial.
Yeah.
So baby can also find their own rhythm.
Yeah, babies will
like
always
with animals.
have their own rhythm because they're just they're just tiny humans, tiny adults. They have their own rhythm. From 32 weeks is when it starts to really become quite defined. Mm-hmm. Some people are before that, some people are a bit after. But the myth, people say, oh, they're so big in the belly now, they don't have enough movement. They won't be moving enough. They don't have enough room. It's actually just different kind of movement. So instead of a punch or a kick, it might just be a little shuffle. Uh-huh. But any reduction in movement is an alarm bell. It's a red flag.
Yeah.
But
also, okay, now I get it. So people kind of using this myth, would you describe that later on they move less, as a explanation of why it's happening, but it's actually a red flag.
It's a red flag. So, I've had unfortunate situations as a midwife because we do see, thankfully it's more happy than sad, but we do get the sad times. And people have actually said, oh, my mum or my auntie or my mother-in-law said, it's fine, baby's just running out of room, when she's voiced her concerns. If that hadn't have maybe been said and she'd been to get checked, she'd have her baby today.
So she lost the baby?
She lost the baby.
Shit.
So I think like that the reason that myth annoys me is because it increases someone's threshold for being checked. I would rather someone come in and I send them home after 30 minutes because it's all fine. Great. Everyone's happy then. Than the other thing.
For sure.
What other myths? C-section's the easy way out. That's a common thing that I hear. Oh, he had a C-section. Too posh to push. It's major abdominal surgery.
What did you say? Too posh to push?
Yeah, that's
a phrase.
Yeah, that's a phrase. It's a phrase. I think maybe it's a British phrase.
Yes, sounds like that.
Yeah. It's major abdominal surgery. It's a huge operation. You're going through 7 layers and then we're taking a baby out and we're stitching you back up. And I think if we cut through most people's core, they'd have a hard time recovering.
Yeah, and pull out, I don't know, a couple of kilos of material.
Exactly. So that's quite a common one, is like, oh yeah, it's just a C-section. I'm like, do you say it's just open heart surgery?
Yeah.
No. Okay, so.
Just a hip surgery.
It's just hip surgery.
Well, sadly, some people, because they are, especially the posh ones, right? Like they increase kind of their tolerance and threshold because Botox here, fillers there, boobs and ass and whatever. So by the time they're pregnant, they had so many surgeries anyway.
Yeah.
That it's just another one.
Yeah, you can become complacent, but any surgery is risk.
Yeah. Okay. Some other myths. If you don't have any, that's fine.
I can't think of any now.
Okay. Well, in case you want to see insane volume of materials, go to Nikki's Instagram because that's packed.
It is.
I want to I want to ask about that Instagram as well, but I have one more question regarding your work. How do you cope? Especially when you said like it's mostly happy, but not always happy. And I think people dealing with death, it's different if it's a doctor who is operating a 65-year-old gentleman and he dies, or you know what I mean? Like dealing with death it always sucks.
Yes.
But dealing with death and grief of the parents when it's in such an early stage, like how do you cope with that?
It's difficult. There's no word for it, which is what I find difficult. You know, like if you lose your husband, you're a widow. If you lose your parents, you're an orphan. But there's no word for parents that lose their children. And I think that always like sits with me when I care for these people. So as crazy as this sounds, I really enjoy the bereavement side of my job. Because I find that you can make such a difference to how people's grief journey progresses in how you look after them during that time, especially if this isn't their home country, if they don't have family around the corner.
It might be just two of them, right?
Yeah, a lot of the time it is. And so in my master's, a part of that is to do with perinatal bereavement. And I do teach a course on it to other health professionals because I think it's such an undervalued like area of midwifery. And for me, sometimes I get upset about it. And I think the way I handle it is to show that I'm upset about it. A bit of a tear, or I well up, especially if I'm with the parents and I've really bonded with them. Or if I'm holding baby and I'm doing handprints or taking hair or footprints or, you know, doing all these memories for parents.
Even the baby's deceased?
Yes. Yeah.
We do
memories for them.
Yeah.
For them. And not bottling that up. I'm not bawling and screaming and crying because that's not my grief, but it's almost like being empathetic. Like I feel their grief and I feel their sadness. So I think just letting that out, it's the best way that I can find to deal with it. Many medical professionals they don't want to do it. They don't want to deal with death. And that's fine. Because if you don't want to do it, you're unlikely to be able to look after that couple and give them exactly what they need. So for me, it's horrible. It's a horrible thing. I wish I didn't have to do it, but when it happens, I'd prefer me to be the one that was doing the caring.
Because you know you can do it well.
Yeah.
Or better than others.
Yeah, well, just like, it's just something that I feel like I'm able to do and I can connect with them well. I don't know why, but it's just something that, it's quite a rewarding part of the job.
Is it happening often?
Not massively often.
Okay.
Not so much here, less here than in the UK. And I think that's maybe because we have interventions such as the induction of labour as the C-section earlier. You know, they're intervening almost too early. So whilst that creates other problems, it usually reduces, prevents a late-term stillbirth. So
there are pluses and minuses on both.
Absolutely.
Yeah.
But it's
well, that's a fucking dilemma, right?
Yeah, right. I mean, the reality is, if you looked at childbirth the way we're supposed to look at it, which is normal, those two things wouldn't be an issue for us. We wouldn't be considering them in uncomplicated, healthy people. We wouldn't be thinking, oh, we need to do this before or this will happen after.
Okay.
We'd just be thinking, okay.
It'll
come out.
Yeah.
It's coming.
It's not even an option.
Yeah. And the sad thing is when things do happen and we have stillbirths, majority of the time we have no idea why.
Really?
Yeah.
Still. So
it's a very difficult.
I mean, last 120 years, we came a long way.
We did, yeah.
Overall as a society with the newborn fatality or whatever that statistics called, right?
Yeah.
So, well, that's tough.
Yeah. But it's part of it. And they're parents. So they deserve to be treated like parents, you know?
Mm-hmm.
And
Yeah.
the parents would have a midwife after they had their child, regardless if that baby is 16 weeks or...
For support.
Yeah.
Mm-hmm.
So it's...
Was there any really tough, complicated case that you like resolved, or then you're really proud of? Something more extraordinary,
Yeah.
you know? Well, you're proud of everyone, I know. You should be. You should be. Every parent is a challenge.
Yeah. I don't know. Most of my proud moments are from like seeing women get what they want and educating them so that they can speak up to get what they want. They don't even need me. I'm there to give them the tools. They're the ones who are building everything with them. But on like a midwifery point of view, when I first moved here, I worked in a hospital, and a lady came in with her second baby, and she declined examination of any kind. So fine, I was like, get on with it. Labour, you do you. And her consultant was at home in bed. It was something like 2, 3 a.m. And we had like a junior doctor, I guess. And this lady was like, I need to push now, and it's not coming out. And I was like, okay. She's squatting at this point, right? Holding onto the table, squatting. And I was like, okay. I was like, I'm going to put a glove on. I was like, I'm just going to feel it. She's telling me something's coming out. I was like, I'll just touch the top of the baby's head. She was like, yeah, okay. So I put my hand like this, and poo comes out. Baby poo. It was breech. It was coming bum first. We had no idea. The junior doctor starts losing her shit because she's never delivered a breech baby before. Me and one of my really good friends, she's a midwife there at the time as well. We did that breech birth. And not many people do a breech birth these days at all, because
I didn't know you even can.
Yeah.
That's happening,
absolutely, yeah.
Butt first.
Yeah, butt first.
Like a water slide.
They'll do a C-section for that.
But you can still
It's a variation on normal, technically. And the thing is, everyone's become so de-skilled at doing those births.
Uh-huh.
Thankfully, me and my friend, coming from the NHS, had actually been exposed to a couple before. So between us, managed to guide this baby out, no problem.
Nice.
Yeah, so that was probably one of my proud, because I'm like, oh, I can count on like one hand the amount of midwives I know who've delivered a breech baby.
Nice.
I mean, it is nice because you don't really do a lot.
Because overall, so this lady, she didn't have any pre-exam, so you didn't know how the baby is turned, right?
Yeah, she declined everything.
And if she didn't, it would be a C-section.
She would be offered a C-section, yeah.
Because
doctor that she was with,
find out, and they would make her or manipulate or whatever. Yeah, the words
the doctor she had at the time is a very good doctor who is very skilled in breech birth. So actually, she probably would have gone along with the woman's decision.
Uh-huh.
So.
Oh, wow.
She's one of very few.
Okay. And, so how does it work? What do you do?
With a breech baby?
Well, why it's called breech? You don't know. It's just the name for
breech,
it. Okay.
Yeah, but bum first.
Bum first, okay.
It can be bum first, feet first.
Okay, so what is the difference? What is the procedure?
So the reason people panic about it is that the head can get stuck in the cervix. So when the body is born, that's the widest part. So your cervix is 10 centimeters. But if you think when your body comes through, your cervix can go almost like round the neck, so it can shrink but down a bit. But then it has to go and let a head through again.
Yeah.
Occasionally babies get stuck. Occasionally. Usually, all we need to do is manipulate the position of the mum and the pelvis to put more weight onto the baby's body, which is now hanging out.
You need to understand the body for that.
You have to understand the body for that. And you have to understand that not just on a anatomy, basic textbook level. You have to understand how joints move, how the pelvis moves. Yeah, everything, the mechanics of it. Okay, the best way to create flexion in the head of a breech baby is to get the mum to almost go into like a prayer position.
So you manipulating the mom, manipulating the baby, and basically doing like a kind of reverse Tetris.
Yeah, well, we're just manipulating the mum, because if a baby's coming out breech, you just don't touch it. Especially if it's out to its shoulders, it's coming out.
Okay.
It's 3/4 out. But people panic. They start pulling or stimulating the baby. Baby can breathe. No ideal. Still inside. So
yeah, because head is inside. Yeah. Okay. So then, when it can get, and now this is completely, probably extremely dumb question right now. Okay, because so it can get stuck around the neck because cervix can get shrink.
Yeah.
Doesn't it happen also when it goes head first?
The head is the widest diameter.
Oh, it's the
so your head will come through the cervix.
I'm thinking about different proportions, obviously.
And then your shoulder, when the shoulders come, our shoulders move. So one of the shoulders, the posterior shoulder drops down. The anterior shoulder will come under your pubic bone. And you're almost like...
that's why sometimes they dislocate shoulder. Because the shoulders are can
hopefully
get like...
not too often.
I just heard that it can happen. I don't know. Okay. But they're all fairly flexible at that point.
Yeah.
So a rubber doll.
Yeah.
Okay, so that's... Oh, shit. Okay. Cool. Well, congrats to that.
Yeah, that was good.
Nice.
It's a good
beat them all. Nikki, your Instagram.
Yeah.
How it started, why it started, and how are you so good at it? And also, like, you started, now have some additional questions to that.
It started when I first moved here. After about 6 months, I was like, what the fuck have I done? This is not midwifery. This is not good maternity care. I hated it. I couldn't do my job to the full extent in which I'm trained. I had to be, yes, doctor, no, doctor, 3 bags full, doctor. I hated it. Even when I knew they were categorically wrong, or I saw them like abusing women, and that's what I'll say, abusing, I had no power.
Basically, you're going against your own beliefs.
100%. So I started it because I was just like, I wish they knew more. And they don't see midwives until they're in labor. So how are they supposed to know more? So I started it as more like an education thing. Like, there must be a way in to people here. And I guess it kind of grew from there. And it was called The Fit Midwife just because I was training at the time. And I saw a different Instagram account that was like a similar vein, like similar title, like a different profession. But I was like, okay, that kind of nice and easy to remember.
A fit lawyer.
Yeah, honestly, it was something like that. Like, and so I was like, yeah, I'll use that. That's fine. And then the training part came later because obviously it all started to blend into one for me. But I just kept getting good feedback as I kept going. Like, oh, that's amazing. I didn't know that. I'm going to ask this next time I go. Perfect. All I want is people to ask the question. Whatever that question is, whatever it's related to.
And you also, basically, your daily work is an inspiration for the post, right?
Yeah.
Because people ask questions.
Anytime
so
people ask me something, I do a post about it. So my material is great because it's like...
You're like 1,400 posts. I checked it.
Do I?
Yeah.
Jesus.
I checked it.
Yeah.
Over 1,400 posts. You do infographics.
Yeah.
You do reels with funny background videos. And like you know, like trending sounds, trending music.
Yeah.
So it's super cool and it's easy to understand.
That's all I want.
You are very charismatic. You know.
Thank you.
It's you also have a TikTok?
I do have a TikTok. I'm feeling my age when it comes to TikTok. I'm not as like active on there, but I'm getting to the point now where...
Because I don't know if this is just from what I've seen, but so many people, like, they have 4-5 times more following on TikTok than the Instagram with exact same content.
I know.
I don't know how.
I don't know
that
what
works.
I need someone young to do that for me. But I'm getting to the point now where like my social media being what it is, and then I'm launching like my courses, antenatal courses, hypnobirthing, education courses on hypnobirthing.
Okay, finish. We have to talk about this.
And I'm launching them online.
Okay.
So it'll be pre-recorded modules that parents can work through.
And this is for parents.
Yeah. So I'm getting to the point now where I'm like, I think I need somebody to help me with the social media side because I also don't know TikTok. I'm not cool enough. I don't know.
Oh, you're cool enough.
Questionable.
No, the videos are cool.
Yeah, I mean,
the content, and especially it's very high value information.
That's what I want. Yeah.
I know that I'm probably not the ideal consumer, or like a pretty average sample because I look at it also differently. I always learn something when I and even it might be even something that I can use.
Yes.
Even it's not birth and it's
That's
body.
It's
body. It's physiology.
It's physiology.
Hormones. Whatever.
Every second person in the world is a woman. Why do we not know more about our bodies?
Yeah, for sure. So I find it extremely. Yeah, you have over 40,000 followers now, killing it. How often do you have to do posts, and how long it takes you to do a post?
I post 3 times a day, so I'll do 2 static posts and a reel. Yeah.
Oh shit! That's a full-time job.
It's a full-time job. I'm lucky because I've had my Instagram long enough now that I can repurpose content. So things that I haven't posted.
I don't even know what that means.
So things I posted this time last year, I can bring and repost.
You can repost it?
Yeah. So I'll just copy the text.
Oh, like okay, manual. I thought it's like kind of feature or something. Okay.
So when I'm feeling lazy or I'm just exhausted, I mean, I have a list on my laptop that's like 2 pages long of content to make.
Just ideas.
Yeah, but I'm just one person as well. I have a full-time job.
So you record everything yourself?
Yeah.
All the hashtags?
Yeah. Everything.
I was... At some point, I was doing 3 or 4 posts a week. And I fucking hated it.
Yeah, I mean, it's like heavy.
Yeah, it's just so much time consuming. And I was doing it also for kind of like an educational purpose. But then it just wasn't worth it for me.
Yeah. The idea is, though, the more I post, it's good for engagement and followers and whatever. But I want to build such a bank of posts for myself that
you can just
I can
rotate
repurpose them. Yeah, I can rotate because I get new followers every day.
All right.
So they're not going to scroll back to 2019.
Yeah.
What did you talk about then?
Yeah.
That's something that I can bring up to the top and go with from there.
That's cool. Well, at least that, right? It's like a little relief. Like, today I'm not recording.
It is.
And you can also actually upgrade it, right? Because you see it,
that's it,
you rewrite a little bit.
Yeah, if something changes, like policy changes or there's new research, you can adapt it and repost it.
Nice. That's very cool.
Yeah.
Yeah, like it's also from design perspective, super nice.
Yeah, I don't know where that came from. It just...
That's not standard
there's
for
a theme and I just ran with it and it seems to work quite well.
Okay, yeah. It's very cool. It's just hypnobirth, or what did you say?
Hypnobirthing.
Hypnobirthing.
It's like mindfulness, breathing, like breath work. It's not hypnosis, even though it's called hypnobirthing, but it's the same. It's the same principles. It's about shifting your mindset about your approach to birth. Some people use it to try and achieve a natural birth as much as possible. So they use it to control their perception of pain or what's happening to them, their control of the intensity of it. Some people use it if they're having an elective C-section and their anxiety is through the roof. So they use like mindfulness techniques, breath work to control what they can control. Mm-hmm. But it's very trendy now, very common.
Cool. Well, when you said it, I was like, oh shit, like you hypnotize people.
To just push it out.
Yeah, it's just, that would be a little bit too relaxing for such a strong experience. Nikki, is there any message you want to send to people, to share some wisdom at the end?
Just that when it comes to pregnancy, postpartum, whether it's training, whether it's the medical side of it, knowledge is power. The more you know, the more you know. And
the more responsible decisions you can make.
Informed decisions. That's what you need to be able to achieve. And it can be something from deciding whether or not you have a medical procedure in a pregnancy, or you choose the right trainer for you. Like buying car seats and onesies, cribs for your baby, all well and good. But you need to invest in the things that matter. And that is your education about becoming a parent and your education about how to manage your body before, during, and after. That's my
cool
pearls of wisdom.
Well, thank you so much. It was mind-blowing on all possible levels. Thank you so much for coming.
Thank you for having me.
And well, I think there is a lot more we can cover next time.
Oh my God!
Still
many episodes of
you
me
can
whinging.
next to your list of topics.
Yeah.
You know, for the post, you can write down.
I'll just write down which ones will be good for this.
Yeah, for sure. Cool. Thank you so much.
Thank you.